Good morning, everybody. I would like to share with us where we are with Allotex. Allotex is around since 2017, and we are processing human donor tissue, allograft tissue for presbyopia and other refractive corrections. Let me introduce you a little bit of the cataract registry in Europe, which has looked at, and there's a nice report from 2019, looked at how is presbyopia currently served and where are refractive procedures being performed in which age categories. And we see, of course, the laser vision correction peak, somewhere around 20 to 30 years old patients. We see the peak of refractive lens exchange or cataract procedures, mainly with presbyopia correcting IOLs. But we see a gap. We see a gap in the early presbyopes. And it's actually quite a significant drop there in terms of numbers of procedures performed and entered into the registry. So these early stage presbyopes are not served today. Now, a big question is, how many of them are actually emmetropic presbyopes? And the European, it's actually from the ESCRS, the European report actually clearly outlines there's only 1% of emmetropic presbyopes in that category of laser vision correction or lens exchange. Now, how many are out there? There's about 250,000 patients a year in US and Europe that undergo laser vision corrections that are fitting into an early presbyope category. There's about 10 million patient pool out there for patients that had laser refractive surgery 10, 20 years ago that are today emmetropic and they're getting into presbyopia. They're seeking for a solution. We heard that nicely from the podium just a couple of minutes ago. And then, of course, there's the big emmetropic presbyopia pool. It's in US and Europe considered to be 135 million people that are age-adjusted and adjusted for income. So how does our procedure work? It's a standard LASIK flap, 110, 120 micron flap. We input an inlay. The inlay is made of an allograft tissue, and then the flap is closed. It's a 7 to 8 minutes procedure. If you take the patient in, create the flap, everything, patient is in and out in about 10 minutes. The implantation is done towards the center of the pupil, and the question is, can you see the lenticle within the inoculation loop? Probably can't, because that's the whole point. We don't make them see. It's going to be a tissue addition. It's made of human donor tissue, and we believe this solution can close the presbyopia gap. So how do we get that? How do we get there? Important is we're taking donor tissue that's not suitable for fresh tissue transplant. We're working with a big eye bank in the United States. We take the corneas, we process it, and we receive about 100 presbyopia lenticle out of one cornea, so it's commercially viable. And we sterilize the tissue that has a shelf lifetime of 2 years at room temperature. So no cooling shipment, nothing. We store it at room temperature, and you can FedEx it to every customer. How do we process this? We built industrial excimer laser systems that are automated for laser tissue processing, and we established a new optical diagnostic to allow precision in the micrometer range. We are blocking IP in that range of processing and making multiple implants from it. But that's nice, that's technically. What about the clinical results? Now we have about 3 years follow-ups in our European multi-center clinical trials that we conducted just before the pandemic, and we now collected the 3-year results in terms of safety and efficacy. And I think the best way to represent is in terms of looking at the defocus curves. And I think the take-home message is today we achieve a full-range vision correction with a corneal solution. So in summary, 89% of the patients achieve 20/40 or better. We have no device-related AEs up to 3 years. And I think, which is important here for this discussion, is we're ready to rumble in Europe. We're going to get commercial in Europe, and we're starting FDA clinical trials pretty soon. Thank you.